Well, in our practice, we have been placing a lot of implants for decades, so we became interested in the laser treatment of periimplantitis. And as an oral surgeon, I find that there are many modalities, but I was very intrigued by what I saw in terms of the results published from colleagues in promotional lectures and so on. And that's where I became interested. But it was after Dr. Serrano, my wife, became interested as well.
I noticed that over the years, more referring dentists are sending patients where some of their implants seems to be starting to fail or losing threads. And after, like my husband said, trying different modalities, and this one came into my hands, I start getting more interested. Then I see now that it's been working, it's been helping patients. I mean, it's been very useful.
Great. I've been using lasers for over nearly 25 years, and they work for as a tool. But this is a whole different level of expectation of a laser to do the kind of work. So naturally, anybody would be skeptical at first. You know, you look at those and say, well, they look too good to be true. And as everyone knows who's been through any part of the training, the lectures and the amount of information feels a lot like drinking from a fire hose, you know. And so initially it was 3 intense days, but the subsequent days of training, they wiped away at least so far, we'll see what today is, but they wiped away that skepticism. And you know, you can see the foundational science is sound. The publications are, you know, well done, and then also you see clinical success.
You said in a particular patient, which she's been complaining for quite a bit about the pain and the discomfort that she was having in the implant, and after we did the series of treatment, and not only clinically, radiographically, but she's been very happy, and I can see the success, and also to make that patient so happy and so comfortable. I mean, where she can now touch her side of her cheek. I mean, that for her was big, but clinically, radiographically has been very successful.
I have been a little bit more preoccupied with other projects. My clinical time has been slightly reduced, but the times where I've used the laser clinically they were, first of all, very easy to use. The procedures and protocols and precautions and everything were very easy to implement. We've had a very easy time training our staff into the protocols and everything, so we've integrated it very easily in our practice. And I also will second what Millie said about the patient's acceptance. As for clinical results, it was impressive the speed with which the response happened, especially in the soft tissues. Granted, I don't do periodontal maintenance or periodontal treatment, but peri-implant work, it's a little too early to tell what the long-term results are going to be. However, initially they were very encouraging. Let me just put it this way. I think we both are very interested in biostim. Having also used other lasers, so I'm very familiar with all of the other uses of the laser. But the reason we specifically wanted the Millennium laser is for peri-implantitis. So for that matter, we only break out the Millennium is for the peri-implantitis, periodontitis treatment. However, I have used it on paresthesia cases. I have used it on some other kind of what we call biostimulation cases. TMJ patients, we used it on some skin lesions. As oral surgeons, they look at me and say, "What are you, crazy? You know, you're buying this laser, that's all for periodontists." But then half of them will say, "You know, I have so many of those cases and I don't know what to do with them. Do you like it?" And you know, and so I think maybe if you go back 5 years, and I'm just guessing, I would probably have an 80-20 people saying you're crazy versus 20% saying, "Oh no, this is something I'm interested in." And I think it's shifting, and I would I would be curious to see how that continues to shift. But it's been well received by those who are discerning, who do a lot of implants.
Yeah.
They ask interested questions. But I think there is, I think as a team of a periodontist and oral surgeon in the same practice, we do have that advantage, is that we expand the usefulness of the laser.